I studied decision making, mostly regarding hard decisions. Decisions that are hard either because there are some complicated facts that you need to know or because it poses hard trade-offs. So I've had the good fortune to work on lots of different problems. So currently I have projects with some people in critical care medicine at UPMC on trauma. One of my graduate students, Victor Rodriguez, is working on how would you tell people about the risks and benefits of brain-computer interfaces when those become available at some time. Another of my graduate students, Eugen Seo, is working on what are people's preferences for the kinds of fleets that automakers would have. Another one of my students, Dick Dunning, is an Army Lieutenant Colonel, is working on when people place trust in AI advisors. In addition to the research that we do, I also have had the opportunity to do a lot of public service. I'm a member of our National Academy of Science and our National Academy of Medicine. I'm currently on the Academy's COVID committee. We have just finished a small project trying to figure out how to do a consultation with the public on defining long COVID. We keep learning more about long COVID. So how do we have a definition that will give you consistency in your social benefits and protections that you give people, and consistency in the research when the problem seems to keep changing. One research project that we did as part of the COVID pandemic was to look at the quality of the instructions that came with the home COVID test kits. We looked at those instructions and they didn't look very good to us. They looked bad, particularly because we thought they would lead people who had a good reason to think that they had COVID to take a negative test result too seriously. Tests are not good enough to overrule your feeling that maybe I've got COVID. So we conducted a study where we compared the official test instructions and test instructions that we developed based on basic research in decision science. We found that our instructions outperformed the official instructions, which in some cases was worse than nothing. I think you can expand the envelope of people's decision-making competence to cover just about anything where people are willing to make the effort. So that optimism, I think is justified by the science, and I think it's good for our democracy.